At first glance, you might not even notice them. They are unassuming yet distinctive. No matter where you look, you'll find them in almost every corner of Texas. A simple sign that directs thousands of Texans each day to a source of comfort and healing. Quick, expert help when illness or tragedy strikes. Its message is simple. Help is close by. Your health is in good hands because you're just around the corner from a Texas hospital. Hospitals in Texas have a rich and colorful heritage, and for the past 75 years, the Texas Hospital Association has been part of it all. The 1900s brought a new excitement to Texas, the oil boom. Driven by dreams of new prosperity, families by the thousands uprooted almost overnight and headed to Texas. What they found was hardly a dream. Living was hard with few conveniences. Hospitals were few and far between, and often serious injury or disease meant death. Clinics and hospitals had come a long way from pioneer days, but care was still basic. Well-meaning people did the best they could with the primitive equipment and medicines they had, guided by a gentle hand and kind word. As our population grew, so did our need for quality medical care. Universities, churches, railroads, and progressive communities responded by establishing hospitals and clinics, which became a source of community pride. They also became a sign of stability and hope. Thousands of survivors of the Great Galveston Hurricane flooded the few hospitals located throughout South Texas, seeking comfort and healing. Overcome with the sheer number of patients, hospitals did the best they could, treating horrific wounds and rampant disease. Their efforts saved many who otherwise would have perished. When the influenza pandemic struck in Europe, killing untold millions, and spread quickly to the U.S., Texas hospitals exchanged ideas on how they might control the deadly outbreak. And while many thousands ultimately died, many thousands more were spared, thanks to the quick action of Texas hospitals. With each new challenge, it was becoming more evident that without a collective voice and leadership, each hospital would face the growing complexities of providing hospital care alone. Knowing that coordination and cooperation would be essential to ensure quality, consistent health care, representatives of more than 40 hospitals gathered in Fort Worth on March 15, 1930, to form the Texas State Hospital Association.
Our early founders knew the value of organization. They understood that coordination saved time and it saved lives. They wisely recognized that pooling their resources, their knowledge and experience, they could improve not only the effectiveness and efficiency of their own institutions, but at the same time greatly improve the health and well-being of all Texans. They also realized that participation in the legislative process was essential in guiding public policy, and not only guiding it, but shaping its implementation for the benefit of those really at risk, and that's the patients.
THA's annual convention became an important means for hospitals to meet and exchange information. The relationships forged during those early years established a tradition of teamwork that helped establish Texas as a national leader in healthcare. As hospitals entered a new age of medical science, two perennial concerns loomed large: serious shortages of nurses and trained staff, and how to make quality medical care affordable for all Texans. With THA's leadership, comprehensive training and educational services were established for members throughout the state. And in a bold move, decades ahead of other groups, THA evaluated and then implemented an innovative program of prepaid hospital care, today known as Blue Cross.
I think it's important to understand that the concept of prepaid health care was not only new to Baylor and to the school teachers, but it was new to Texas and new to the nation, because the Baylor Plan, as it was known as at one time, and later became Texas Blue Cross, that concept was endorsed by the entire nation and by other nations. We didn't know it at the time, but our work to put quality health care within the reach of all Texans would lead the nation in conscience and efficiency. Having great medical care available doesn't matter if you can't afford it. Our members did recognize that access for all to health care was a key part of the program. And they recognized that the Blue Cross movement would achieve just that.
World War II hit hospitals hard. Shortages, rationing, travel restrictions. Even metal bedpans became part of the war effort. Doctors and nurses rushed into service, followed by many hospital staff, leaving pink ladies, nuns, and a few others to hold things together back home. Victory brought its own set of challenges. Returning troops found military hospitals filled beyond capacity. Community hospitals weren't much better. No new construction. Precious few beds added. The post-war baby boom, along with the needs of returning soldiers and their families, put a severe strain on Texas hospitals. The government's solution was a detailed census of facilities and patient needs. New prosperity and the demand for jobs drove new hospital construction. The creation of new, more sophisticated medical centers across the state also produced new job opportunities.
This was government's foot in the door, so to speak. The beginnings of intervention by government into the most personal area of our lives, our health. When it was obvious the government legislation would prevail, THA turned its efforts to ensuring that implementation was sensitive to local needs and those of our patients.
Then, disaster struck. This time in Texas City. A ship loaded with ammonium nitrate fertilizer had caught fire and exploded. Moments later, a nearby chemical plant exploded, hurling cars and trucks hundreds of yards. Vast parts of the city were leveled and burning. All day long, the work of caring for the injured and fighting the fires was underway. By nightfall, the town was filled with rescue and hospital workers. And as ambulances made repeated trips to area hospitals, darkness did not stop efforts to find those still trapped in the wreckage. When the smoke cleared, 600 plus people were dead, and more than 2,000 injured. Once again, Texas hospitals and their dedicated employees saved thousands of lives, often at great risk to their own. A great tribute to the communities they serve. Once again, THA turned hard-learned lessons into statewide benefits. A statewide hospital plan was formalized, and guidelines for training and licensing healthcare professionals were established. To share information with members on a more frequent basis, THA began the publication of Texas Hospitals. The magazine quickly became a popular means for members to stay up to date with the latest trends in treatment and the latest industry news. The polio epidemic in the 40s and 50s filled wards with children, many crippled, unable to breathe without cumbersome and expensive iron lungs. Texas hospitals worked closely with local health officials in schools and communities in a massive public education campaign. And later, when the Salk and Sabin vaccines became available, hospitals opened their doors for marathon immunization clinics to protect their communities from this deadly killer. Polio vaccines joined the list of medical advances gaining national attention. From Texas research hospitals and medical centers came bold new treatments for cancer and heart disease, and for many, their first hope for effective treatment. New treatments were costly, and with increasing demand, costs spiraled. Healthcare was out of reach for the elderly, poor, and disabled. A showdown was inevitable, and this time the fate of healthcare would be decided not by patients or hospital administrators, but by politicians. Federally mandated standards and access for healthcare became law under Medicare and Medicaid. The administrative entanglements have become enormous over the past 40 years, and so have the red tape and costs.
It didn't take me long to realize that where the pressure was coming from on our hospitals was coming from down here in Austin and from Washington. I had a volunteer board who hadn't been involved in politics, and I had not been involved in politics. But I had enough sense to realize that we needed to be closer to where the action was. It gave us the opportunity then to develop politically our own members. After a period of time, we were able to convince a majority of our members, an overwhelming majority of our members, how important it was to take part in local elections and to meet with local people who are running for office and let them know what their thoughts were, because it was important to the overall delivery of health care in the state of Texas. We knew that our members' well-being no longer involved just medical decisions. It would involve legislation and implementation. We didn't want anyone to fall through the cracks, especially our patients.
Over the years, Texas hospitals became famous for meeting great challenges, some natural, some catastrophic, and some, sadly, by the hand of man.
Here is a special bulletin from Dallas, Texas.
3 shots were fired at the president's motorcade as it passed out of the downtown area of Dallas. The Secret Service immediately gave orders for the procession to speed out of the crowd and took the president directly to Parkland Memorial Hospital.
From Parkland Trauma 1 came the news. A gravely wounded president could not be saved, even by the most heroic of efforts. While in other corridors, other floors, babies were born, hope renewed, and life went on without skipping a beat. Texas hospitals and health systems quickly became the international standard for excellence in technology and care.
Texas has always attracted dreamers and visionaries, people who looked at the impossible and got it done. This has helped us build and staff some of the finest medical institutions and research facilities on the planet. In many ways, Texas hospitals and systems have taken imagination and helped it become reality.
Houston, Tranquility Base here. The Eagle has landed.
Roger, Tranquility. We copy you on the ground.
Human footprints on the moon, a bold test of technology and medicine, began with scientific research conducted in Texas hospitals. From the reaches of outer space to the depths of the ocean floor and everywhere in between, Texas hospitals and medical centers have led research aimed at making life better for everyone. Their optimism was short-lived. Just when it seemed that the big killers had been subdued, a new one emerged, suddenly and dangerously, without a known cure. Its name was human immunovirus, the precursor to AIDS. As the first cases hit, Texas hospitals scrambled to make preparations. This one wasn't going to go away quickly, and its implications and financial demands would be enormous.
The Center for Disease Control warned us it would be bad. and it was even worse than the earlier predictions. Our members implemented strict infection control procedures. AIDS was unforgiving, and we would take nothing for granted. Next, hospitals, through THA, all reached out to their communities with educational programs aimed at prevention. And because of the stigma and hysteria often attached to the disease in those early days, THA became the voice of reason, pushing for solutions, backed by science, and sponsoring legislation to preserve patient privacy and make treatment available and affordable. Hospital caregivers reached out to AIDS patients, treating them with dignity and respect.
With each new challenge, Texas hospitals see a new opportunity to serve. Their trade association does too. Over 75 years, THA has evolved to become the leading advocacy organization for Texas hospitals. Policy experts, extensive data collection and analysis, and timely, targeted communication are focused on legislative and regulatory issues that affect all Texas hospitals. From member involvement in policy development to grassroots advocacy, THA uses its political clout to shape public policy on the complex issues facing hospitals now and in the future. It's no wonder that from those tiny clinics and far-flung prairie hospitals have grown some of the most advanced medical facilities in the world. That same vision that brought these early dreamers to Texas kept them here and helped them establish hospitals that today lead the world in treatment, prevention, and research. Every minute of every day, in hundreds of hospitals, large and small throughout Texas, thousands of skilled medical professionals are working with but one goal: to improve the health of those they serve.